Hey guys, this is Chris Dewey with May River Medicare, and thanks for dropping by. Today we're going to talk about how to find the best Medicare Advantage plan in 2023. And there's really only three types of people that are my clients that have Advantage plans. And the first group of people are disabled people. People on Medicare that are under 65. My girlfriend's a disability attorney. So after she wins her case, they have to be on disability for 24 months. On the 25th month, they get Medicare. They get their Part A and Part B. So my job is to find the best Medicare Advantage plan based on their drugs and doctors. So that's the first group of people. The second group of people are my low-income folks that are over 65. Got a lot of folks when I lived in Savannah. They're my clients. They're living in Section 8 homes. They're making anywhere between $700 to $2,000 a month. And the third group of people, those are folks that turned 65, that saw a Joe Namath commercial, or their neighbor said, hey, my plan, I get a free plan with free dental and free vision. And what they didn't realize is, and I'm going to send you a video this week on the difference between Advantage plans and Medicare supplements. They were misinformed. If you can afford a Medicare supplement, you want to go with your original Medicare card and your Medicare supplement that pays all or most everything. And that's a story for a different day. We're going to be positive today because most of you have to have an Advantage plan. You're under 65, you're on a low fixed income, or you're stuck with an Advantage plan at least until fall enrollment, okay? So let's go right into it. Okay, so the first step in finding the best Medicare Advantage plan is, in a few more weeks, you're going to get what's called the annual notice of change. Let's take a look right here. Here it is. Annual notice of change. September 19th, you'll probably get it. Latest September 30th. Biggest step in making sure that we want to either stay with our plan or leave our plan. So questions, if you have a Part D plan, when you get that annual notice of change, you want to make sure that your medications are covered next year. All right, you want to make sure that there's no coverage restrictions for the medications you take. Maybe there's quantity limits or authorizations, prior authorizations. That's where you need an agent like me to help you with that. You got to find out, hey, how much am I going to pay for generic and brand name drugs that I take? Has the premium changed? I remember a few years back, clients of mine had WellCare. It was $8 a month for the drug plan. It went up to $85 the following year. Has the Part D drug deductible changed? You want to look at all these things. All right, so if you have an Advantage plan, when you get that little annual notice of change booklet, September 19th, okay, so the other thing is the worst way you could find out if your doctors are in the network is if you call the front desk at your doctor's office. Hey, do you take United Healthcare? Well, let me check. Oh, yeah, I saw them take United Healthcare yesterday. No problem, guys. There's 8 different Medicare Advantage plans that United Healthcare has. There's PPOs. There's HMOs. There's diabetic special chronic needs plans. There's Medicaid, Medicare, United Healthcare. So don't do that. What you want to do, you can either call me, or the best, easiest way to do it is go to United Healthcare Medicare site, click on find a provider, type in your zip code, and type in your doctor. We do all that for our clients. We do all of this stuff. I have 2 assistants that do that like 10 hours a day from October 15th to December 7th. So, and next thing is, this is really, in my opinion, besides the doctors, the single most important factor to look at with an Advantage plan. So it's called your maximum out of pocket. What does that mean? That means, what's your worst case scenario? If you get sick and actually have to use this Advantage plan, what's your limit of spending? How much do you have to pay yourself? Most maximum out-of-pocket plans that I've seen from the first looks, from the 2023 plans, are anywhere between $6,700 and $7,500. Medicare changes the Medicare Advantage deductibles. They change their maximum out-of-pocket, and they have certain limits to the drug deductibles. So the insurance companies have to act accordingly and change their numbers as well. But $7,500, so that would be if you had cancer, you have to pay 20% of all cancer treatments on Advantage plans, so you'd hit that $7,500 in a couple months. You go to the hospital, most plans are $400, anywhere between $300 and $500 per day for days 1 through 4. That's how you can get that maximum out of pocket. You want to find the lowest maximum out of pocket that you can find. All right? And I'm going to go over that in a second. So the last thing is the copays for the hospital is big, but even bigger, what's the copay for outpatient surgery? You'd much rather have a copay of, let's say, $375 for outpatient surgery rather than 20%. A lot of plans have been sticking that in. 20% outpatient surgery, oh great. And that includes MRIs, CAT scans, 20%. So you want to find a plan that has a copay of like $300-400 for outpatient MRIs rather than 20%. Some plans have that. You can end up paying $5,000-6,000 could be your share for outpatient surgery. So you got to be real careful. Okay, moving on. Step 2. What we want to do, and really it's step one for me. When I'm your agent and you're interested in an Advantage plan, usually there's 3 reasons why. You're either disabled and under 65 on Medicare, you have a low fixed income, which you can qualify for programs that we're going to talk about. Number 1, first program that I always put people in immediately is the Extra Help program. Now, if you want to do it yourself, it takes 2 seconds. Just Google Extra Help for Medicare. It'll take you right there. It literally takes 3 minutes to fill out the application. It's income-based. So here's the magic number. It's $1,719 if you're single. Now, I always tell people if you're married or you're separated, what you can do is say, I'm married but not living together. If that's the case, you don't want to you don't want to fib, you don't want to lie, but if you're married and you're not living together, you're separated, there's some issues going on there, you're married but not living together, or just put separated, okay? So that's the magic number, 1,719. Let's just say if you're right around between 1,700 and 1,800, you want to apply for this. Why do you want to do that? Because your drug prices, all right? Your drug prices are going to go way down. You're going to pay 50% coinsurance, 15% coinsurance on the plan, whichever is less, or the plan's copay, all right? Also pays partially for your Medicare Advantage premium. It'll partially pay for your Medicare Advantage premium if there is one. Chances are with Advantage plan, you shouldn't have a premium. Most of them are 0 premiums, okay? So if you are right around the 1,600 mark, you're going to get all your brand names for $985. That's it, $985. That's incredible. All right. You're going to have a 0 premium, a 0 deductible. So this Extra Help plan is huge. Okay. Sorry about that. It was my son. I'll call him back after. He's probably out of school early today. So that's it with the Extra Help program. It's simple. It's easy. You definitely want to do it. The next thing I want to talk about, getting that $170 back that they take out every month. $170 that they just, some of you might not even notice it. But keep in mind, if you have an Advantage plan, you still got to pay that $170 unless, here's the magic number here, $1,549 for an individual. So let's focus on that. Again, if you're married, it's going to be $2,000 for the both of you. But if you're married but are separated, married but not living together, or separated, you check that box, and they're only going to go based on your income. All right? So if you're right around the $1,600 mark, you want to definitely apply for what's called a Medicare. Let me show you. It's called a Medicare Savings Plan. All right? And the eligibility requirements to get that $170 paid for, $1,549, really, just if you're in that $1,600 range, you want to apply for that. You can apply for that. Let's say you're in Georgia. You can go to just type in Georgia Medicaid for seniors, or just Georgia Medicaid. You'll get there. Call me. I've got an assistant that does all that every single year for my clients. Does your agent do that? Do they actually apply for these programs year in and year out and handle all your customer service issues? We do that. Okay, so I just want to hit on that. I've got other videos that really expand on it, but the magic number is for Extra Help. If you're right around $1,700, $1,800, apply for it. Your drugs won't cost as much. You might not have a deductible or premium. And then on the flip side of it, on the other side is that $170 qualified individual. If you make right around $1,600 or less, you can get $170. That $170, they'll put that back in your check every single month. So that's step 2, and we're going to get to step 3 right now. Okay, guys, and the very last step, the third step. Easy thing to do, go to Medicare.gov, Plan Finder, compare. You can log into your account or create one to access your drugs. Or better yet, what you can do is you could also go to the link below this video where it says Shop Plans. And what you can do is you can shop plans and you can come right here to my website. I would be your agent if you decide to self-enroll. But before you decide to self-enroll, don't get too daring. And I would suggest you call us, call me or one of my assistants. What I did was, so when you click on shop plans, you're going to go to my Christopher One Life website. You're going to type your zip code in, 29910, so if you're in Bluffton. But you can, whatever zip code you're in. And you're going to come here. And we already did the Medicare Advantage plans. And what you can do is come down and do the preferences, put your drugs in, put your pharmacy in, which I already did. So what I decided to do is I put amlodipine, Eliquis, and I put a asthma spray in there, just a nice little mix of things. So after you put your drugs in, and how do you do that? You just go add preferences, and then you just click, you want the most of you are going to get the medical and prescription drugs. Most of you are not eligible for special assistance because you probably haven't even applied yet for it. All right. But if you are, you would click the, don't worry about this, just continue. Don't worry about that. They don't need to know what your health is. There is no underwriting in Medicare Advantage plans, okay? And then I just put, this guy is my doctor. I added the provider, and then it came to drugs, and I typed in my drugs, which here they are. So, edit. Let's see what I put in for drugs. All right, I put amlodipine, I put Eliquis, and we'll just put Ventolin. Maybe you got asthma. All right. Would you like the generic? Sure, I'll take the generic. I'm a big fan of generics, less expensive. All right, so boom, we continue. And then what we're going to do here, and you can do this on Plan Finder, you can do this on my website. There's a few carriers I do not put in there because I've had bad experiences with. We're going to start clean this year and give them a second chance. So I put Publix as your pharmacy. We continue. And we continue. And I wouldn't, they all give you a little bit of dental and vision benefits. But this is how you compare. You put your drugs in. You let the computer do all the heavy lifting. And so what you want to do is when you sort this stuff, what's the total cost, guys? That's what you care about. What's the total cost? So when I type these drugs in, now I'll tell you, WellCare's fine, okay? However, don't get too excited when they say dental and vision. Hard to find a provider that takes the WellCare built-in dental and vision, but there are a few out there that do. All right, and what it comes down to is your drugs. $126 annual cost for drugs, $211 here, $249 here, Clover's $257, Humana's $258. So basically you want to look, and again, WellCare, you know what? What I do like here with this no premium, wow. Look at this maximum out of pocket, all right? That's huge. That's very low comparatively. So let's look at this one. One WellCare plan's enough. Let's look at Clover, pretty solid plan. And then we'll look at the, it's got a deductible. Let's look at this plan right here. Let's see, wait a minute. Let's see. This plan looks good. So you can compare them, and then you compare. And guys, I would highly recommend you get an agent to do this stuff. There's a lot of small print. But anyway, so what they're saying is $126 for your drugs with WellCare, $257 with Clover, $263 here. What's the next big thing we look at? We're looking at maximum out of pocket. Look at this. WellCare, $3,400. Guys, if you do choose WellCare, do not do it alone. Have an agent to be the buffer between you and the insurance company, which is WellCare. Trust me on this. If you're going to go with WellCare, don't self-do it. You can enroll on here, but just make sure you call me and let me know. It pops up on my computer, but you're going to need my help. All right, it's WellCare. They typically deny sometimes routine medical claims. You just got to be aware of that. No big deal, easy to appeal. That's what I do and my support staff does as well. So, and what the biggest thing, what do you want to look at? You want to look at the summary of benefits. Summary of benefits. So, plan documents, view more. So let's look at the Humana plan documents real quick. All right, you click on plan documents, and this, here it is, benefit summary. That's all you need to look at, guys. Benefit summary. And what that's going to do is it's going to break it down. And big thing is zero premium, $5,900 in network, $11,000 out of network. If it's out of network, that's your max amount of pocket, worst case scenario. You got a $375 copay for outpatient, $298 for days 1 through 5. And then, of course, cancer, it gives you a little bit of dental, gives you $2,000 in dental, but read the fine print, okay? Read the fine print. What is your share of it? What is their share of it? These are just things you got to kind of be aware of. All right, so like, for instance, you're going to pay 50% of fillings, all right? You're going to pay scaling and deep root, the plan pays, so your share is 70% there. You're going to pay 70% for periodontics. So just be aware of that, guys. It's not, okay, you get zero for oral evaluations. You get zero for, teeth cleanings and things of that nature. But again, read all this very carefully. All right, so that's how you find it. And it's a no-brainer, honestly. Again, well, I'm not crazy about WellCare. Don't ever try to call their customer service. You're just going to pull your hair out. But if you're talking about maximum out of pocket, which I said is besides your doctors being in network, that's the most important thing, all right? So $3,400 is half of what this Clover is, and it's significantly lower than Humana, max out of pocket, worst case scenario. And the next video, what I'm going to talk about is, hey, you know what? Wouldn't it be nice to have a plan that pays your hospital bill? It pays your $375 per day, 1 through 7, pays that for you. Wouldn't it be nice if it paid your hospital, paid your cancer? Tomorrow we're going to talk about a hospital cash plan for $30, $40 a month that covers the weak spots in these Advantage plans. Weak spots being cancer, you got to pay 20% of cancer. You're going to pay $300 to $400 a day for days 1 through 5, 1 through 4, whatever. You want that covered, and you also want the outpatient surgery covered as well. So those three things: cancer, hospital, outpatient. $30 a month. Most of these plans don't even have a premium. They're all zero. Don't be a fool. Get the hospital, get the cancer. You can get it all built in for $30, $40 a month. So when you go to the hospital and you're like, oh boy, holy cow, I owe $375 for days 1 through 7. All right, you don't know anything. I got a plan that pays that for you. All right, you guys have a great day. Bye-bye.